Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
In Health Today, we tell you Barbados is on alert for a painful disease already affecting its Caribbean neighbors.
The region on the whole is now learning about chikungunya. Barbados does not have an experience with it with respect to our public health, but this is what happens to the science, meaning that things happen, new diseases, new and emerging threats, so we have to be prepared for it.
It's not a matter of if, but when will the new mosquito-borne virus chikungunya find its way to our shores?
The likelihood of us having the whole issue of chikungunya is certainly at our doorsteps.
The sober caution of Acting Chief Medical Officer Dr. Kenneth George, who tells Health Today the country is ready to respond.
Barbados is on alert. We have strengthened our surveillance, and surveillance is detection of disease across the island. We're working closely with the Environmental Health Department and our epidemiology unit within the Ministry of Health to first collect the data. Secondly, to ensure that the public health measures for control of mosquito breeding sites are instituted. And thirdly, to communicate effectively with the public.
Our regional neighbors have not escaped the virus. Since last December, when the first cases were identified on the French side of St. Martin, chikungunya has made a rapid march across the island chain. 1 week ago, the Caribbean Public Health Agency, CARPHA, declared chikungunya an epidemic, reporting more than 4,100 cases in 14 countries.
I would like to clearly state that we have no confirmed cases of chikungunya. You know very well that Barbados is going through a period of drought or lack of rainfall, and that's fortunate because mosquitoes tend to breed in the wet season. So that I think that the time for vigilance is certainly now, because once we start to get rainfall, the levels of mosquito breeding within our island will probably increase.
That familiar mosquito is the Aedes aegypti, which also spreads dengue fever. In fact, the symptoms of dengue and chikungunya are so similar that it can be quite difficult to identify one from the other. But Dr. George says the two viruses are quite different.
The good thing about chikungunya is that it confirms immunity, unlike dengue fever. There are not subtypes. In dengue fever, you have 3 or 4 subtypes, and you know that if you're infected with one or more subtype on any particular, at 2 particular different points in time, the likelihood of you having a worse outcome, meaning dengue, hemorrhagic fever, or shock syndrome, is increased. Chikungunya is not like that. Chikungunya fortunately confirms what we say, potentially lifelong immunity.
A person infected with chikungunya will suffer from high fever, headache, severe muscle and joint pain, and a rash. Symptoms appear between 4 and 7 days after an infected mosquito bites. Dr. George says it's hardly fatal, but the effects may linger for a long time after infection, and this is cause for concern.
The actual problem with the disorder is not only the acute phase, but it has a prolonged illness, so people tend not to recover as spontaneously as, let's say, dengue fever, so that there is a long period in which people convalesce. And it's the convalescence period that the Ministry of Health is worried about, because persons obviously may not be able to work, and they may not be able to do the normal things that they do.
Children, the elderly, and people who suffer from chronic diseases such as hypertension and diabetes are most at risk. There is no specific treatment for chikungunya, nor is there vaccine. The medical official says controlling mosquito breeding sites is the best approach, and that begins at home.
They need to inspect their premises. The Environmental Health Department has indicated at least once a week. For me, it should be twice a week. It's a simple walkthrough of the premises, looking at mosquito breeding sites, tires, pots for growing your little plants, etc. Even places that may accumulate water even on your roof. So that may be a good way to commence your program.
He's also advising people traveling to countries which have confirmed the presence of chikungunya to take the necessary precautions.
They should walk with their mosquito repellent, buy it here and use it there. They should be very aware of their surroundings. They should take every precaution to also spread a message that this is communicable. They may even want to carry their bed nets.
In the meantime, Dr. George assures the Ministry of Health will maintain its surveillance, and he's urging citizens to play their part. Why not try our health tips?
Keep your house and surrounding areas free of stagnant water, especially during the rainy season. Wear light clothing. Dark clothing attracts mosquitoes. Use mosquito repellents and mosquito nets to ward off bites. Stay in air-conditioned or cool areas.